Dear brothers, as we pass the age of 60, our bodies begin to undergo many changes. Some are easy to notice, like graying hair, wrinkled skin, and declining strength, but others happen silently. If we're not paying attention, by the time we notice them, they may have already caused significant trouble. One of these is an enlarged prostate. I've met many patients, most of them strong men who were once the pillars of their families. Then one day, they start noticing that urinating becomes harder, they have to strain more, and they wake up several times a night to go to the bathroom. At first, they think it's just old age and try to put up with it. But over time, the symptoms don't go away. Instead, they begin to disrupt daily life, causing insomnia, fatigue, and in some cases, even hospitalization due to acute urinary retention. In today's conversation, I want us to take a closer look at this issue: why the prostate becomes enlarged, what symptoms to watch for, how it's diagnosed, and the most modern treatment options available today. Most importantly, we'll understand that this is not a death sentence, nor something we're forced to live with forever without a solution. I'll explain everything in the simplest terms, just like I do when talking to patients in the clinic, so that all of us over 60 can fully understand and take charge of our own health. 1. Causes. Brothers often ask me, "Doctor, why is my prostate suddenly getting bigger at this age? I haven't done anything wrong." In reality, the root cause mainly lies in the body's natural aging process. The prostate is a small gland located just below the bladder, surrounding the upper part of the urethra. When we're young, it's usually about the size of a walnut. But as we reach middle age, especially after the age of 50 or 60, the hormone levels in our bodies begin to change. Specifically, testosterone, the male hormone, is still present, but it gradually gets converted into a stronger form called DHT, dihydrotestosterone. This DHT stimulates prostate cells to grow, and over time, the gland enlarges. Aside from hormones, other factors contribute as well. People who are overweight, have abdominal obesity, diabetes, or high blood pressure are at higher risk of prostate enlargement. This is because metabolic disorders and chronic inflammation in the body create an environment that supports gland tissue growth. I've seen many patients of the same age and lifestyle habits, but those with larger waistlines and less physical activity tend to have a faster-growing prostate and more severe symptoms. Genetics also plays a role. If your father, uncle, or brother had an enlarged prostate, there's a higher chance you'll experience it earlier than others. What I want to emphasize is this: prostate enlargement is not cancer. Many patients panic when they hear your prostate is enlarged, fearing it's a sign of cancer. In reality, benign prostatic hyperplasia, BPH, and prostate cancer are two different conditions, though they can sometimes occur together. That's why regular checkups and screenings are crucial to clearly distinguish between them, preventing unnecessary anxiety or overlooking a serious issue. In short, the main causes are age and hormones, along with lifestyle and genetics. While we can't completely avoid it, we can understand it, take control, and manage it in time. 1. Causes. Brothers often ask me, "Doctor, why is my prostate suddenly getting bigger at this age? I haven't done anything wrong." In reality, the root cause mainly lies in the body's natural aging process. The prostate is a small gland located just below the bladder, surrounding the upper part of the urethra. When we're young, it's usually about the size of a walnut. But as we reach middle age, especially after the age of 50 or 60, the hormone levels in our bodies begin to change. Specifically, testosterone, the male hormone, is still present, but it gradually gets converted into a stronger form called DHT, dihydrotestosterone. This DHT stimulates prostate cells to grow, and over time, the gland enlarges. Aside from hormones, other factors contribute as well. People who are overweight, have abdominal obesity, diabetes, or high blood pressure are at higher risk of prostate enlargement. This is because metabolic disorders and chronic inflammation in the body create an environment that supports gland tissue growth. I've seen many patients of the same age and lifestyle habits, but those with larger waistlines and less physical activity tend to have a faster-growing prostate and more severe symptoms. Genetics also plays a role. If your father, uncle, or brother had an enlarged prostate, there's a higher chance you'll experience it earlier than others. What I want to emphasize is this: prostate enlargement is not cancer. Many patients panic when they hear your prostate is enlarged, fearing it's a sign of cancer. In reality, benign prostatic hyperplasia, BPH, and prostate cancer are two different conditions, though they can sometimes occur together. That's why regular checkups and screenings are crucial to clearly distinguish between them, preventing unnecessary anxiety or overlooking a serious issue. In short, the main causes are age and hormones, along with lifestyle and genetics. While we can't completely avoid it, we can understand it, take control, and manage it in time. 3. Diagnosis. Dear brothers, when you experience the symptoms I just mentioned, the first step is not to self-medicate based on hearsay, but to see a doctor for a proper examination. That's because benign prostatic hyperplasia, BPH, is completely different from prostate cancer, and in some cases, the two conditions can exist at the same time. Getting an accurate diagnosis is the most important step toward finding the right treatment. A typical examination starts with a detailed discussion of your symptoms: how many times a day you urinate, how often you wake up at night, whether you feel discomfort or need to strain. These questions are standardized using a scoring tool called the IPSS, International Prostate Symptom Score. This score helps classify your condition as mild, moderate, or severe, and guides the doctor in deciding the appropriate treatment. Next comes a digital rectal exam, where the doctor gently inserts a finger into the rectum to feel the prostate. I know this makes some men uncomfortable, but the procedure takes only a few seconds, is not painful, and provides us with valuable information: the size of the prostate, its consistency, and whether there are any hard areas that might suggest cancer. Then come the lab tests. A simple blood test for PSA, prostate-specific antigen, can help determine whether the enlargement is likely benign or possibly cancerous. A urine test is also done to rule out infection, and sometimes an ultrasound is used to measure the amount of urine left in the bladder after urination. In more complex cases, the doctor may order a transrectal ultrasound, a uroflowmetry test to measure urine flow, or even imaging of the urinary system. However, for most patients, just a few simple steps are enough to confirm the diagnosis. The key point I want to emphasize is, don't be afraid to get checked. A single visit can give you peace of mind by clearly showing what's going on. If it's benign prostate enlargement, there are plenty of effective treatment options available today. And if something more serious is detected, early diagnosis always leads to better outcomes. 4. Lifestyle treatment. Dear brothers, doctors don't always prescribe medication right away when the prostate is enlarged. In cases with mild symptoms, or when the condition hasn't significantly affected quality of life, lifestyle changes alone can be very effective. I often tell my patients, adjusting your daily habits is a free treatment with long-term benefits. The first step is adjusting how and when you drink fluids. Many people have the habit of drinking lots of water in the evening or sipping tea or beer while watching TV. As a result, they end up waking 2 to 3 times each night to urinate. By simply limiting fluid intake, especially after 7 p.m., the number of nighttime bathroom trips can be greatly reduced. Next is avoiding bladder irritants. Coffee, strong tea, alcohol, and carbonated drinks all stimulate the bladder, leading to more urgent and frequent urination. You don't have to cut them out completely, but if you notice that your morning coffee makes you run to the bathroom repeatedly, it might be time to cut back. Another often overlooked point is strengthening the pelvic floor muscles. Simple exercises, similar to Kegel routines, tightening and relaxing the muscles that control urination, can, if done regularly, improve bladder control and reduce post-urination dribbling. Maintaining a healthy weight is also crucial. I've seen many patients whose nighttime urination and weak stream symptoms improved noticeably after losing just 10 to 15 pounds, 5 to 7 kilograms, of belly fat. That's because obesity increases chronic inflammation and adds pressure on the bladder. Lastly, develop a habit of scheduled urination. Instead of waiting until your bladder is uncomfortably full, try going to the bathroom every 3 to 4 hours. This can help reduce urgency and accidental leakage. It may sound simple, but these small changes can make a big difference. For many of my patients, just making these lifestyle adjustments has significantly eased their symptoms, improved sleep, and lifted their spirits, without the need for any medication. 5. Medication treatment. Dear brothers, when lifestyle changes are no longer enough to control the symptoms, it's time for your doctor to consider medication. The good news is that we now have several effective drug options that can significantly improve your quality of life, often without needing to think about surgery. The first and most commonly prescribed group is alpha blockers, such as tamsulosin or alfuzosin. These medications work by relaxing the muscles around the bladder, neck, and urethra, making it easier for urine to pass. Many patients notice improvements within just a few days to a week: stronger urine flow, less straining, and better sleep at night. A point to note is that alpha blockers can cause postural hypotension, feeling lightheaded when standing up quickly, or retrograde ejaculation. However, these side effects are usually mild and manageable. The second group is 5-alpha reductase inhibitors, such as finasteride or dutasteride. These are recommended for men with significantly enlarged prostates, typically over 30 grams. They work by targeting the hormonal pathway that causes the prostate to grow, gradually shrinking the gland over time. The benefit is a reduced risk of urinary retention and less chance of needing surgery later on. However, the effects take longer, sometimes several months, to become noticeable. Some patients may experience side effects like decreased libido or erectile dysfunction, so it's important to have a thorough discussion with your doctor before starting these medications. In many cases, doctors may prescribe a combination of both drug types, providing fast symptom relief from the alpha blocker and long-term disease control from the 5-alpha reductase inhibitor. There are also additional options. For example, low-dose daily tadalafil, a drug commonly used for erectile dysfunction, can also improve urinary symptoms. If you're dealing with both BPH and sexual dysfunction, this may be a 2-in-1 solution. For men whose main issue is urinary urgency or frequency, doctors may also prescribe anticholinergic medications or beta-3 agonists to help relax the bladder muscle. The most important thing with medication is patience and regular follow-ups. Your doctor will monitor how well the treatment is working, manage any side effects, and adjust the dose as needed. Medications aren't magic, but for most patients, they bring noticeable relief and can delay or even avoid the need for surgery. 6. Procedures and surgery. Dear brothers, the truth is, not everyone with an enlarged prostate needs surgery. It's only when medications are no longer effective, symptoms become severe, or complications arise, such as recurrent urinary retention, frequent urinary tract infections, bladder stones, significant blood in the urine, or kidney problems, that we begin to consider medical intervention. And when we talk about intervention, it's important to know that it doesn't always mean open surgery, as many people fear. Modern medicine now offers several minimally invasive options that allow for quicker recovery and minimal impact on sexual and daily function. The most traditional and long-standing procedure is TURP, transurethral resection of the prostate. This involves inserting a surgical instrument through the urethra to remove excess prostate tissue that's blocking urine flow. It's been considered the gold standard for many years, very effective, but it may cause some side effects such as retrograde ejaculation or bleeding during the procedure. Today, there are gentler alternatives. For example, Rhizome therapy uses steam vapor to destroy excess prostate tissue. The procedure takes only 10 to 15 minutes, causes minimal discomfort, and over a few weeks, the prostate shrinks, improving urinary flow. Many patients prefer Rhizome for its good preservation of sexual function. Another method is UroLift, where small implants are placed to lift and hold the enlarged prostate tissue away from the urethra, widening the passage. The benefits are a quick, non-tissue removal procedure, fast recovery, and minimal impact on ejaculation. However, UroLift is best suited for prostates that aren't too large and don't have an enlarged median lobe. There's also HOLEP, holmium laser enucleation of the prostate, which uses a laser to remove excess tissue. It's highly effective even for very large prostates. And then there's aquablation, a newer technique that uses high-pressure water jets, guided by a robot, to precisely remove tissue. It offers results comparable to TURP, but with potentially fewer sexual side effects. In larger medical centers, another option is prostatic artery embolization, PE, where interventional radiologists block some of the blood supply to the prostate, causing it to shrink over time. It's a less invasive technique, though careful patient selection is key. The main point I want to emphasize is this. Today, there are many treatment options, ranging from mild to more advanced, depending on each person's condition and preferences. There's no longer a need to panic at the thought of surgery. What matters most is early consultation, so you and your doctor can choose the treatment that best suits your needs. 7. Complications if left untreated. Dear brothers, many people think, well, I'm getting old. Difficulty urinating is just normal. But in reality, if an enlarged prostate is not properly managed, the long-term consequences can be serious. The most common and immediate complication is acute urinary retention. Imagine being out and about, or suddenly waking in the middle of the night, desperately needing to urinate, but being completely unable to. The bladder becomes painfully distended, causing intense abdominal discomfort and sweating. At that point, the only solution is an emergency hospital visit to insert a catheter. Most patients who've experienced this say it's something they never want to go through again. If this happens repeatedly, the bladder is placed under constant strain, eventually leading to bladder muscle weakening and stretching. Over time, even if the obstruction is treated, normal urination may not fully return, and control becomes more difficult. Another complication is recurrent urinary tract infections, UTIs. When urine remains in the bladder for too long, it creates a perfect breeding ground for bacteria. You may experience burning during urination, frequent urges, fever, and chills. Some patients are hospitalized multiple times due to these recurring infections. Prolonged urine retention can also lead to bladder stones, which cause pain, blood in the urine, or interrupted urine flow. More seriously, the backflow of pressure toward the kidneys can lead to hydronephrosis and eventually kidney failure, the most dangerous complication, which can directly threaten your life. Let's not forget, ongoing blood in the urine or chronic retention can disrupt your daily life, causing poor sleep, loss of confidence, fear of traveling far from a restroom, and negatively impacting mental health, physical well-being, and even family relationships. The important thing is that all of these complications are preventable, as long as we detect the condition early and treat it properly. Don't wait until it becomes an emergency to see a doctor. By then, treatment becomes much more complex, costly, and difficult. Final thoughts. Dear brothers, today we've walked through the complete picture of benign prostatic hyperplasia, BPH, why it happens, its common signs, how it's diagnosed, and the full range of treatment options, from lifestyle changes and medication to modern, minimally invasive procedures. I also touched on the possible complications if we ignore the symptoms and delay treatment. The most important message I want you to remember is this: BPH is not cancer, and it's not a life sentence. Thanks to modern medicine, this condition is manageable. You can live comfortably, sleep better, and maintain your confidence and independence well into your 60s, 70s, and even 80s. If you find yourself experiencing any of the symptoms I've described, don't hesitate. Consider it a signal from your body, encouraging you to see a doctor early, get a few simple tests done, and receive the treatment that suits your condition. A proactive decision today can lead to many healthy, active years ahead. And if you found these insights from Senior Vitality Now helpful, please leave a like, share your experience in the comments, and subscribe to the channel so you won't miss future videos. Your support is the motivation that helps us continue delivering clear, practical, and accessible medical knowledge to the community. Remember, health is not fate. It's the result of small, repeated choices every day. Make wise choices today, and you'll enjoy a healthier, happier, and more fulfilling later life.